For this chapter, we're going to learn alveolar to arterial oxygen tension gradient. What does it mean? So we know that for the previous lesson that airway resistance can contribute to ventilatory failure. So this is just a continuity of the previous chapter. So what are mechanism or what are phenomenon, no? What kind of phenomenon that is happening to our respiratory tract that can create a respiratory failure? So in this respiratory subject, so there are some languages, no, respiratory language that is new to you as first year student, no. So this will going to be, I'm going to introduce certain languages in respiratory, what you call respiratory subjects such as shunt mismatch, ventilation mismatch, perfusion mismatch. So what does it mean? So perfusion can be related to a mechanism of exchange of gases. You know, in elementary we learn the simple definition of ventilation. Let's make things simple now. So we define ventilation as movement of air in and out of our lungs. So that's very elementary, no? So movement of air coming in and coming out of the lungs. In a deeper scenario of respiratory medicine, there is what we call respiration. So as we go to a junior high, our teacher in biology teach us the proper respiration. So when we say respiration, it reflects to a cellular level of chemical reactions, no? So there is a chemistry, there is physics on that physiology. So what will happen when we respire or when we are doing respiration? So there is an exchange of carbon dioxide during exhalation, and there is an intake of oxygen during inspiration. So basically, we learn from our basic science that the air is composed of 78% nitrogen and 20.9 to round off, it's 21% in the atmospheric air mixture, which is oxygen, and 1% inert gases such as nitrogen, argons. So in your chemistry, those are light gases. No, so it means that this gases is lighter, like helium is more lighter. The molecular weight of helium is different from the molecular weight of an oxygen, which is heavier a little. So we know that the molecular weight of our oxygen is 16 compared to helium, which is more lighter. So this later, as we go on these gases under your pulmonary function test, we know that these argon inert gases will remain as a fractional residual capacity of your lungs. So that is a deeper knowledge on the lung capacities and lung volumes. So prospectively on this topic, we go to the basic muna as first year student of RT of Central Philippine University. So let's make things very simple. What does David Chang wants you to understand about this alveolar to arterial oxygen tension gradient? So it is about the lesson or the equation depicts or it reflects on shunting. So ano ang ibig sabihin kung the lungs undergoing shunting? So ibig sabihin you are breathing, there are two types. You are breathing on 21% oxygen as a normal individual, as a normal student. We are breathing on a 21%, but the present of shunting should be acceptable. So the shunt value or the percentage of shunts varies to the age of the patient. So in normal air, in normal room air, so as we age 10 years, no? So kung in every 10 years of age, there is a factor what we call there should be an acceptable and should be acceptable values every 10 years should be 4 millimeters of mercury ang normal A-a oxygen tension gradient nyo. So, ibig sabihin, if you are 40 years old, so sabi sa context ng equation, in every 10 years old, the acceptable A-a gradient tension or the A-a gradient must be less than 4 millimeters of mercury. Sir, ano yan ibig sabihin? So, you need to divide 40 by 10. So, the acceptable shunt percent must be 4% for that case in room air. Again, class, that is acceptable. The concept of the author of every 10 millimeters, the acceptable value must be less than 4 millimeters of mercury. So, sir, bakit may capital letter? So, I want to give emphasis to the equation also that in this respiratory math, the A for the arterial tension represent the alveolar. Don't be confused. Alveolar, as you divide alveolar pressure to your arterial. So, to make it simple, go back to human anatomy and physiology. So, nag-circulate ang blood, di ba? So, the blood is circulating from your heart. That's why it's called cardiopulmonary system. So, from upper extremities, it will be covered by what they call the upper extremities by superior vena cava, and your lower extremities, way back to anatomy, will be both going to the lungs by your inferior vena cava. So vena cava is a Greek term from the word vein, so it reflects the vein. So it means that these blood are unoxygenated, going from the system from superior and inferior vena cava, going to right atrium. So after right atrium, it will go to your tricuspid valve, going to your right ventricle, going to your pulmonary artery, and then going to your lungs for perfusion. Okay, perfusion is an advanced term for respiration. So when you say perfusion, dapat nag-exchange ang carbon dioxide sa oxygen. But there are some cases because of this shunting. So, it can be refractory hypoxemia, the common clinical scenario na the patient, nagbigay ka na ng oxygen, but the patient doesn't respond to your oxygen therapy. So, nagkakaroon ng shunting. So, ibig sabihin, the exchange of gases is not normal. So, imbis na oxygenate ang patient, hindi siya nag-oxygenate because there is shunting na nag-happening sa ACMN niya, or what they call the alveolar capillary membrane. So ACM is like a structure. If you do, this is like circular siya. So this is ACM as alveolar capillary membrane. So nag-exchange sa capillary membrane mo ng smallest part of your lungs. So which is your alveoli, no? When we say alveoli, that's plural. Alveolus, that is singular. So, tricky, no? So, because lungs is a binary organ. So, we have the left and the right. So, the singular will be alveolus. The plural will be alveoli. So, siya yung structure, the grape-like structure, wherein the diffusion takes place. So, dapat pag ang dugo galing from heart, from pulmonary artery, it should be pushed going to the structure of your lungs. That is the basic anatomy, no? If you review your anatomy, then perfusion or respiration must be dapat mag-occur sa area na yon. But there are cases, no? So, what are these cases? It can be hypoventilation. It can be persistent VQ mismatch. Sounds technical for the first year, no? VQ is a terminology for perfusion in respiratory physics. We have persistent intrapulmonary shunt. There are 5 factors. The fourth will be persistent diffusion defect. So, diffuse ka na diffuse. Ang lungs hindi nag-excrete ng carbon dioxide, hindi rin nag-absorb ng oxygen. So, that will be what we call persistent diffusion effects, no? And then we have persistent reduction of your partial pressure of your PaO2. That sounds to be another new terminology. So I hope you continue read with the basic Bible, which is the EGANS, the fundamental, so that you can sink in with this a new version, no? So major subject, this is your first major subject in your respiratory subject. So uh, this intakes some technicalities. Sometimes the word itself, because the pulmonary medicine has its own language, no, even respiration. So now, as you get out of or after attending this video or virtual class of mine, you can translate respiration into a word perfusion. So that's why may sariling language. That's why di ba may subject tayo na medical terminology, because different discipline, different languages. So if you take up neuro, if you take up physical therapy or other discipline, so if you take up respiratory, it has its own also language. So go back to equation again on chapter 2. So that is for room air. So in every 10 years of age, the normal A-a tension or the A-a oxygen tension gradient must be less than 4 millimeters of mercury. But in cases of patient under closed system, pag sinabing closed system, those patients are put into, again, into artificial airway. So artificial airway, these patients are hooked again into a mechanical ventilator. So if there is a mechanical ventilator, there is what we call a sub-zero environment or a closed environment, which is according to your equation in a clause 2, if in 100% oxygen, anong sabi? Pag sa 100% oxygen ang ating patient, so every 50 millimeters of mercury difference in A-a tension gradient is equals to 2% shunt. So shunt, no? So this equation, sir, anong ibig sabihin ng sinasabi mo sa chapter 2? This chapter tell us very simple, the absence of respiration. So I don't want you to use respiration. It is the absence of perfusion inside your lungs. So this equation, there are two cases. One is in the room air. The clause number 1 or the explanation under the first paragraph under the equation represent the room air, which is 21% environment, and the second or the number 2 represent on the concealed environment, whereas the patient is hooked to a ventilator which undergoing 100% oxygen, so or FiO2, fraction of inspired oxygen. So if the case is, be careful with the quizzes or in your sometimes exercises, the book will give you a case of 21% or room air, and the other cases will give you 100% or patient are put into a mechanical ventilator. So the equation varies case to case. So you don't be confused na nag-compute ka ng room air sa case na naka-ventilator, or either ways, you interchange the formula. So this is physics, no? This is respi physics or respi math. So appreciate and you need to internalize the case based on the equation. So each cases requires different RT math, no, or respiratory math. So and I said iba ang computation to derive the alveolar arterial oxygen tension gradient or sa patient na naka 100% mechanical ventilator. Remember, in every 100% FiO2, there is a 50 millimeters mercury that is times to 2% shunting. So, guided ka sa exercises, more or less, on exercises number 2, it reflects on the other advanced computation of your alveolar arterial oxygen tension gradient. So, ano sir, to make it simple, this pertains to absence of perfusion. So, ilang percent ang shunt na required sa kada case in 21% environment and in 100% environment. So you need simple, as you see the complication and the simplicity of the equation of David Chang. Ano ginawa niya? Given all the what we call this, the normal value or the given example of such PA, tension, arterial oxygenation, sinubtract niya lang. Then once you subtract, you need to analyze if this pasyente ba to na kinukompute ko ay naka room air 21% or ang kinukompute ko na pasyente is given ang FiO2 naka-concealed sa sub-zero environment or closed environment, which is put under mechanical ventilator with an artificial airway, of course. So may tube siya. So those are patient na different ang computation. They varies the shot. So for, again, as I remember the magic number, the 4% and the 2%, that will make you perfect in computing the shunt. No? So again, because sometimes perfusion defect occurs in our lungs. So hindi nag-oxygenate, hindi tama ang pag-diffuse ng gas sa loob ng ating lungs. So where does the gas perfusion particularly the structure? Again, ACM. Just remember the word ACM, alveolar capillary membrane. So siya ang nagkakaroon ng diffusion. So you need to analyze if your ventilation nag-diffuse ba or may shunting ang patient. This formula of chapter 2 will help you detect or identify patient that has that nagsha-shot sila if there is a presence of pulmonary shunting. So it is acceptable or over that percent given. So you can analyze. No, this is only a start for the basic physics of respiratory calculation. Many formulas and many computation you are going to expect during your clinical duties and your medical center, when your institution, may ma-assign mo kayo sa Manila or you will be assigned other medical center. This can help you determine if your ventilator is effective to your patient. So sometimes this gradient is always incorporated in the ABG result. Was supposed to be, it should be computed as a respiratory therapist, but now we are on millennial, so even the Gym Premier ABG machine, siya na mismo nagko-compute. You need also you need to get the result na lang. So there is a thermal paper after you feed the blood, no? So this entails about the blood exchange or diffusion property inside your lungs. That is very simple. Chapter 2 teach us about pulmonary shunt. Okay, as we go on with the equation, so the formal equation, ito, sa whiteboard nakikita, I hope you can see it clear as water, no? So this is the formula for alveolar arterial oxygen tension gradient, no? So the formula is very simple, but be careful with the case 1 and the case 2, diba? At environment which the patient is subject, and the subject is under 21% room air, and the second, the patient is under 100% FiO2 or environment. So you need the equation suggests that alveolar arterial oxygen tension pressure gradient is equals to alveolar pressure of oxygen minus the partial pressure of your arterial oxygen no, sa PaO2 mo. So this is given. What you're going to do with the equation is to you do substitution of the equation prior to the figures given. You do substitution, then shortcut, no. So you derive the answer of 15 millimeters of mercury. So what is very important in solving the partial pressure, the pressure of your alveolar arterial, is your patient age. one factor you need to consider the patient age, and then second is the FiO2. That's very simple. So avoid erroneous results or confusion, no? You, after computation, consider the patient age. Ano sabi sa golden rule? In every age 10, there will be, the result must be less than 4 millimeters of mercury. If the patient is on 100% FiO2, so in 100%, in every change of 50 millimeters mercury, there is a 2% shunt, no? So this is, okay, analyze the given figures in the equation. So this is very elementary, no? So you need to subtract lang niya ang alveolar pressure of oxygen to your arterial oxygenation, arterial pressure. So partial pressure of oxygen in arterial, partial pressure of oxygen in alveolar. Don't be confused. Alveolar represent the capital A, whereas the arterial oxygenation represent the small letter A. So you need to subtract and then derive the answer. So 100 minus 85, you derive 15 millimeters of mercury. Very simple. But this is 21% and your patient is 40 years old. So rule number 1, it applies to rule number 1 that in every 10 years of age. So how will you interpret that into equation? So put the age, then divide it by 10. As you divide, you get the result of 4. So that's because in 40 there is 4 sets of 10, diba? So 4, then in every 10 millimeters of mercury, there is a shunt of 4%. So for this equation, the shunt is 16. 16 siya. So is it acceptable? Yes. So acceptable value siya sa shunt mo in this case. So let's you review your canvas, and there are some exercises and some mini work work exercises regarding this for this solving or problem related to this chapter or related to this equation. Please check your canvas under your worksheet, no? So may mga exercises tayo in every chapter. It has been explained with the proper title sa canvas nyo kung this problem exercises is about chapter 1 or chapter 2.